Welcome back everyone to the final part of this topic, and here we're going to be looking at immune pharmacology. So how we can, manipulate the immune system to treat some of the disorders that we talked about previously. We are going to start with how allergic hypersensitivity reactions are inhibited through the use of antihistamines. So in terms of detailed learning objectives, they're to be able to list physiological processes that are inhibited by antihistamines, list common side effects of antihistamines, and explain why some antihistamines are sedating and others are non-sedating. So when allergic hypersensitivity reactions are inhibited, most of this is done using an antihistamine, for example, brand names such as Claritine, right? And these antihistamines are histamine antagonists. So we should all know what that means at this stage. It means that these are drugs that bind to the histamine receptor to cause it to assume its inactive state. So they antagonize the activity of histamine by preventing histamine from binding to its receptor. Now, there are 3 different types of histamine receptors in the body that I think I've mentioned previously. The H1 receptor, when it has histamine bound to it, will stimulate inflammation and allergic reactions. So ideally, this is the one that you want to be inhibiting to treat this allergic reaction. H2 receptors are present in the digestive tract, and when histamine binds to those, that will stimulate gastric secretions. And H3, with histamine bound to it, mainly affects the central nervous system. So as I mentioned, an ideal antihistamine for allergic reactions would antagonize H1 receptors. Now, unfortunately, the first generation antihistamines that were developed for the treatment of allergic reactions were lipophilic, so they cross the blood-brain barrier to cause things like sedation. The newer sort of generation ones are more selective for the H1 receptor, and they also seem to decrease eosinophil migration to also reduce inflammation. However, the effects of these drugs are very variable from individual to individual, and they're really used, on a trial and error basis. Many of them you can buy over the counter as well at the local pharmacy. So what are the effects of the antihistamines? Well, they're pretty much decreasing all of the things that histamine stimulates. So histamine causes vasodilation and vascular permeability. The action of the antihistamine will to decrease both of these. Antihistamines will also decrease smooth muscle contraction that occurs under the influence of histamine. So that occurs in most smooth muscle, but not vascular smooth muscle cells, because obviously histamine causes vasodilation in this case. So for example, under the influence of histamine, smooth muscle contraction or causes bronchoconstriction in the airways. And this is thought to be a protective mechanism to stop pathogens from getting down into our lung tissues. Histamine will also stimulate sensory nerve endings to cause itching, so antihistamines will decrease that too. Now, some antihistamines will also prevent motion sickness, so they can act as an antiemetic due to their effect on the central nervous system. They can also be used as sedatives, so this might be a wanted effect of using an antihistamine. Now, obviously, you wouldn't use an antihistamine that has a sedative effect if you were going to drive to Melbourne straight after listening to this recording. But sometimes you might want to give an antihistamine, as a mild sedative if somebody is sick and they just want to be able to, sleep through the night. Some antihistamines will also weakly antagonize the muscarinic acetylcholine receptor. Remember, the muscarinic acetylcholine receptor, when acetylcholine binds to it, that will decrease the heart rate. So some antihistamines can weakly antagonize that to increase the heart rate. Or activation of the alpha-1 adrenergic receptor will result in an increase in blood pressure, and some antihistamines can also weakly antagonize that too. So in general then, the unwanted effects of antihistamines include this sedation. Sedating antihistamines do cross the blood-brain barrier to cause drowsiness, And the non-sedating ones then don't cross the blood-brain barrier to cause drowsiness. But having said that, there seems to be great variability from individual to individual in terms of, how they react to an antihistamine, with about 15% of people who take a non-sedating antihistamine claiming that they do actually feel drowsy after it. Other central nervous system effects then include tinnitus, so that ringing in the ears, fatigue and dizziness. There may also be some peripheral antimuscarinic effects, and the most common one is dry mouth. And then there are GI disturbances reported by some people as well. And that makes sense, right? Because the H2, the histamine 2 receptor is located in the digestive tract. And when histamine sort of binds to it, that will stimulate gastric secretions. So if you remember from last year when we studied the digestive system, even the thought or the sight or the smell of food would cause histamine to be released and acting then on those parietal cells of the stomach to release hydrochloric acid. So just finishing up on some antihistamine pharmacokinetics. These are in general very well tolerated drugs and pretty safe to use. They're often used in topical treatments, so including nasal sprays for runny nose, eye drops for watery eyes. Most oral antihistamines are effective for about 3 to 6 hours. They're metabolized mostly in the liver and excreted in urine. However, as I've mentioned a couple of times, sort of the period of effectiveness from individual to individual can vary. And there's also the potential for PK interactions with the antihistamines and other drugs.